But perhaps there is no nation on earth with a bigger crisis than India. They are on track to overtake the U.S. as the nation with the most cases worldwide. How did this happen in a place that initially achieved success containing the virus? Our Ian Panel brings us this in-depth report.
Mohsin Khan used to speed through India's capital to save the living. Today, the medic races to collect the dead, weaving through Delhi's clogged streets, bodies swathed in white, ready for cremation, in a race to slow the spread of a disease coursing through India's veins. It now has the world's fastest growing rate of infection and death. Today, 2 more COVID-19 casualties are added to the more than 100,000 deaths. And more heartbroken families must mourn and grieve and bid farewell to their loved ones. This is what passes for an ordinary day as India gets hit by a second wave far more vicious than the first, preying on the most vulnerable. Today, Mohsin had to pick up the body of a 3-year-old girl.
My heart breaks. I have seen so many bodies.
It's beyond his remit, but Mohsin makes sure the little girl is laid to rest in dignity.
The family is poor and cannot afford a cremation. I called this man from an NGO to come and help pay for it.
It's the grimmest of jobs, exacting a terrible toll. The bodies keep piling up. India seeing nearly 2.5 million new cases just this past month.
At this time, we're seeing more patients and deaths. We're picking up 7 to 8 bodies on a daily basis, and 2 to 3 are going to the graveyard.
It's an unimaginable loss for a country that had relative initial success in containing the virus. Back in March, India joined much of the world in shutting down. The world's second most populous country gave just 4 hours' notice before imposing one of the most rigid lockdowns. It paid off. Deaths were relatively low compared to hotspots in Europe and the US, but the country of 1.3 billion people was too quick to reopen. Desperate to revive its economy, businesses resumed and public gatherings soared.
What will matter is how many of us are alive at the end of pandemic. Those who lose their lives will not come back to revive the economy.
Migrant labourers from the rural areas coming back into the cities were partially to blame for the uptick in infections. And by summer, the pandemic was ravaging its way through the nation's capital. We were in a New Delhi hospital this past June. Doctors in full PPE. Patients hooked up to ventilators.
These are the sickest of the lot.
The beeping in ICU wards, the soundtrack to a crisis steadily getting worse.
He's not waking up.
India's cases were starting to climb.
This situation is unlike anything which we have seen ever before. We are really struggling and we are trying that we can deliver our best. But yes, it's really tough.
The situation wearing on the doctors, but not yet a crisis point.
Whether we'll be able to continue like this or no, I don't know. But as of now, we have been able to manage.
But today, medical professionals in the country are sounding the alarm. India is now second only to the United States in having the most COVID cases, topping 5 million.
In most of the big cities, we are reaching a saturation point where most of the hospitals are choked to capacity. There is a scarcity of ventilators.
And as the relatively well-equipped cities struggle, the rural areas are finding it even harder to tamper the surge of infection. Much of the frontline care falls on the shoulders of volunteers like Pushpa and Shimlesh Devi. 2 women with some medical experience going door to door in Badapur. The town's only an hour from Delhi, but it might as well be light years away. Doctors, medical equipment and care all severely in short supply in this densely populated area, so prevention is key. It starts with the most rudimentary form of contact tracing, chalk in hand.
परिवार के सदस्यों की संख्या बताओ आप कितने सदस्य हैं आपके परिवार में
The women write how many people live in each household on the doorway with the date, making their rounds through each neighborhood by foot, asking people if they've had symptoms, checking temperatures. It's a community effort where one person answering questions can mean the difference between life and death. In areas with poor education, they spend their day spreading awareness about a disease many still know little about. But it's in underdeveloped areas where attention and care is needed most.
There are only 2 hospitals, one in Barterpar and one in Dadri, both catering to a lot of villages. 2 hospitals in so many villages. If it spreads here, it will be terrifying.
One day at a time, 1 foot at a time, and 1 body at a time. These are the workers willing to take the risk to save India from the virus. For Mohsin, the day doesn't let up. When he gets home, he tells his wife there were a lot of patients, but even more dead bodies. Every day, he transports people, many to their graves, and they all stay with him.
There was a kid who died because of COVID. He was just 5 or 6 years old. His parents didn't go near him, but it hit me hard. I felt so much pain in my heart that I was standing and crying because we are the ones that had to go and bring the body. This thing doesn't allow me to sleep at night. A kid is dying, a father is dying. What kind of disease is this?
His job brings him pain, but his family know it's also key frontline work. He tells us his family was scared of what he was doing, being so close to death, but now they're proud that he's doing his bit to save others from coronavirus. Ian Pannell for ABC News Live.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.